Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical health care. I am happy to welcome Dr. Pamela Wible, physician's guardian angel, and known as America's leading voice for ideal medical care. Welcome to Redefining Medicine. I am so thrilled to have with us today Dr. Pamela Wible, otherwise known as the physician's guardian angel. So we'll get into that in a little bit. But Dr. Wible, why don't you share with us your story, essentially? You practiced family medicine, correct? Mm-hmm. Okay, so.
Yeah, both my parents are physicians, and as a little kid I used to follow them to work. My dad is a pathologist, so I used to work with him in the morgue as a child. Ooh. And my mom's a psychiatrist, so she would take me to the psych hospitals. So basically I was around really seriously mentally ill people who were institutionalized and dead human bodies as a child, and that was like the perfect petri dish for a blossoming healer to be able to experience like the real underbelly of what goes on that's usually hidden from children, you know, because parents like to read little happily ever after stories to their kids when they're little, but I got to see real life, and that made me like wake up to the reality of human suffering and pain, and just be, he introduced me even when I was 6 years old as a doctor in training, and he would sit me between himself and his live patients.
Okay, I was hoping.
He would leave me actually with the dead patients too. He'd introduce them to me with the toe tags, and then I was a real talky child, so he just left me there talking to them. And so I was just like totally comfortable with death and mental illness, and in a way that most people, even adults, aren't.
So you went to medical school.
Mm-hmm. I always wanted to be a doctor.
Okay. Where did you do your training?
I went to University of Texas Medical Branch in Galveston, where my mom went to school, and we just went to her 50th medical school reunion as a mother-daughter duo, which is probably very unusual for a mother and daughter to go to the same medical school. And it's just, I had a really fascinating, fun experience during my medical training. It was traumatic when I started medical school because I just didn't realize the whole sort of patriarchal reductionist philosophy was very heartless and soulless. You know, they kind of dehumanize you a little bit during medical training. But
you weren't forewarned by your parents? Did they want you to be a doctor?
They did not want me to be a doctor, but they didn't, it's very typical of physicians. They don't want their children to be doctors, but they don't necessarily explain to them why. So I think the interpretation that the child has is maybe my parents don't think I'm smart enough to do this. The parents, or the physician, father or mother, never really explain it was like being in Afghanistan. I had PTSD. Like, they don't go into the details of their mental health wounds from the training because I don't even think they want to remember it. You know, it's almost like in the back of their consciousness. But they know they don't want their kids to go through it. See what I'm saying?
Yes, yes. Okay, so fast forward, you were in family medicine.
Uh-huh. And I still practice, and I do house calls and have my own little clinic, and it's really awesome.
So what was the trajectory to lead you to your focus today?
So my focus on physician suicide is probably, the passion comes from I was suicidal as a physician myself in 2004, and that was completely occupationally induced due to frustration of being forced to be a factory worker practicing assembly line medicine in 7-minute increments, which I thought was a complete assault to my soul. I saw medicine in its heyday when I went to work with my parents, so I knew this was kind of like bullshit, basically. I hope you don't mind me using these words, but I knew better, and so I felt like I was being abused as some sort of, they wanted a warm body in the room to generate as much revenue per millisecond as possible. They could care less about the patient's health or about whether I'm happy or whether I'm practicing at the highest level of my skills. That was not important. So these are just corporations that unfortunately are about collecting revenue and maintaining their high overhead infrastructure.
So you were actually cognizant of the fact that you were suicidal.
Mm-hmm, yeah, for 6 weeks I didn't get out of bed after leaving my last job.
And you had suicidal feelings
I was trying
and
to
thoughts
die
at
in my
that moment.
sleep, yeah.
Okay. And did you ever have these feelings when you were doing your training?
I was very depressed my first year of medical school, like extremely suicidal, mostly because they were having us do dog labs and killing our pet, previous pets
Right.
is terrible. Murdering dogs as part of your training. I just couldn't believe the amount of brutality I was witnessing and the mass dehumanization, methodical dehumanization of me and my classmates. I thought it was it was like a torture chamber. Spiritually and emotionally speaking, it was unreal.
I can imagine. So take us back. So how did you get yourself out of that?
Out of the suicidal
Yeah.
thought? Well, I had like a dream, like a prophetic vision. It wasn't really a dream. It felt very real, but literally I woke up. I think when you're in a state of suicidal thinking, you end up sort of melting away your ego. If you don't care whether you live or die, you're in a very receptive state, I think, to like messages from the universe. It's definitely an altered state, okay? And so I ended up having a vision of like floating over the United States, seeing like communities take back the healthcare system, and like firefighters and police officers and nurses and doctors all holding hands and building their own clinics. And I was like just overtaken with the whole idea that I didn't have to put up with assembly line medicine anymore, that I could create a clinic based on what my community wanted. And I literally jumped up out of bed and called the newspaper and started leading town hall meetings and inviting my community to design their own medical clinic. I went from like not moving and suicidal, like almost like in a coma for 6 weeks, to like running town hall meetings and inviting my community to design their ideal clinic. I collected 100 pages of written testimony, adopted 90% of what they wanted, and I said I would do whatever they want as long as it was like basically legal. And so then I opened this clinic, the first one in the country, designed completely by patients, and I did that a month later with no outside funding. And that's where I've been practicing for 13 years, and it's awesome. Highly recommend it.
So what's different about the clinic?
It's relationship driven instead of production driven. So it's kind of like the way doctors used to practice before third party intrusion. So it's just me. I have no nurse or no receptionist. I check everyone in. I submit all their claims myself. I have it all streamlined so it's super easy. And I just work like afternoons and evenings 3 days a week. So I never have to set my alarm for work for 13 years. I've never turned anyone away for lack of money. And so I see everyone who needs to see me. And I am like happy as can be, if you can't tell. And so are my patients.
That's phenomenal. So, but you've also made it your mission to educate practitioners. So can you discuss that?
Yeah, I had no idea at the time when I was suicidal that it was an epidemic that had been covered up since 1858 in England, the first time that the high suicide rate among doctors was written about. And so I thought I was the only one, which I think is very typical when people are suffering, especially physicians. They feel like they're the only one, because if you look around, everyone's in their starched white coats doing the fake smile, acting like they got their act together, and they really are all suffering like they're prisoners of war, basically from our training, which is rampant with human rights violations, and we can go into that in a minute. So I just was shocked in 8 years after my suicidal thinking, and having launched my practice as my solution to my occupationally induced suicide, being a real doctor with autonomy as an entrepreneur and business owner, solved my suicidal distress, because I didn't want to be treated like a bad kindergartner, which is kind of how these corporations treat physicians, right? Terrible. So 8 years later, I ended up, and I live in Eugene, Oregon, at a memorial service for the third doctor that we lost to suicide in just over a year. So I was in the second row of his memorial service, and I just started like counting how many doctors that I knew had died by suicide, and I knew like 10. I don't know anyone who's not a physician or medical student that's died by suicide. I've never lost a patient to suicide. I have like now a list that I've investigated of over 1,100 doctor suicides, because I started running a suicide hotline. All these doctors keep calling me. There's a huge unmet mental health need among doctors, and they don't feel safe enough to go to a psychiatrist because they don't want it on their record, but they trust me for some reason because I keep blogging about this and talking about it. I'm sort of like nonstop,
Is there a particular specialty that's more at risk?
Yes, anesthesiologists. Male anesthesiologists are at a huge risk. In fact, anesthesiologists die by suicide at 5 times the rate of general internal medicine and twice the rate of the next highest specialty, which is surgeons, and then there's emergency doctors.
Is it because they have more access?
Yes, access.
Wow.
Yeah, it has a large part to do with it. I think veterinarians are also at huge risk, also due to
Same access. So when your parents found out that you were suicidal,
I don't think they really knew.
But did they ever understand why?
Well, I was on the phone crying all the time my first year of medical school with them, and they didn't really know what to. I mean, they're like, yeah, everyone goes through that. And I mean, I didn't find them helpful at all because my parents are not really emotionally and spiritually engaged people. They're more, my mom is more like a drill sergeant, you know what I mean? And my dad is more like an absent-minded professor. I mean, they try to care, but they're not like, I'm a super spiritual and emotional person, and I think I completely baffle my
Were you always
parents.
this way?
Yes, because I'm just so like on a spiritual journey through life, and most people in my family are more on the how much can they make in a capitalist culture journey, and I don't play that game, so I don't think they understand what to do with me or how to interpret what I'm motivated, like why would I talk about suicide for 6 years? I don't know. I don't think my parents don't really get me, I think.
Do they understand and appreciate the clinic that you set up initially?
I think so. Yeah, my mom was a business owner, so she thinks that's definitely the way to go. And my dad, I think they do understand that. But I didn't find them as a first-year medical student helpful at all. But for the most part, because I was suffering so much, it was like an existential dark night of the soul, and I couldn't, I think they understood medical school was hard, but I was crying constantly. I cried so much my first year of medical school that I woke up one day and my eyes were sealed shut. I couldn't even open my eyes. And I couldn't go to class. I had to feel my way to the bathroom in my apartment. I have never cried that much in my life. Even when I was suicidal, I wasn't crying. I was just sleeping. But my mom mailed me psych drugs in the mail so I could take them. So that's what my mom did, and my dad just tried to be like, oh, it'll pass and keep going. And
you need to get through this time, first couple of years.
Yeah, right.
Okay.
Everyone.
Right. So, what would you like to see different
in medical
training? During the medical training period? Yeah, medical school
I would
and
like
post-training.
that people should be embraced as a family when they arrive. They should be welcomed you've jumped through enough hoops, you're the cream of the crop, you've already proven yourself, you're all valedictorians. We love you and we're here for you and we're going to support you till the end, and here's my phone number and I'm the dean and you can call me anytime. If anyone has problems, you're not alone. And they should have a little mental health panel at the beginning where all sorts of other physicians who are highly esteemed in the school can share hey, when I was a first-year medical student, I failed an exam, I had panic attacks, but hey, now I'm the chief of surgery. And so people can see examples of it's okay to freak out, it's okay to fail a test, it's not the end of the world, I'm loved, I'm welcomed. Earlier I mentioned before our interview that a medical student wrote me and told me that she was less stressed in Afghanistan during active sniper fire in a war zone than medical school. So of course I called her wanting to find out why. And she said, well, at least when she was in Afghanistan, she knew that the other people on her team, first of all, she knew who was the enemy and who was on her team. In medical school, you don't know who's going to undermine you, who's really your friend, because they pit everyone against each other and have you terrified for your life and your career and that you're going to fail, So they create a terrible, competitive, cutthroat, mean-spirited environment that makes sensitive, existential, humanitarian idealists freaked out, That's not the way to handle gifted children, is to pit them against each other and treat them like bad kindergartners. They're already motivated. You don't have to scare them to learn. They already want to learn. They're already valedictorians, you know what I mean? But they treat them like shit and scare them to death that they end up just alone in their apartments crying themselves to sleep at night, which you don't see during the day because they put on a smile.
You don't see that on Grey's Anatomy,
No,
for
you
example.
don't see that on Grey's. But the thing is, she knew that if she got slaughtered by a friggin' landmine, that her team there of American soldiers would pick up her body parts, put them back in a casket and put an American flag over it and send her home. She knew she wouldn't be left there. See, medical students, if that were to happen, they would just think everyone would walk right by and leave you dead on the floor, which is kind of what happens, actually. Because I went to I led a candlelight vigil and a memorial service, a funeral for a woman who was the third one who stepped off the roof of Mount Sinai, of this building in Mount Sinai, and they just friggin' left her there covered with a tarp on the ground. Nobody brought any flowers, nobody did anything. I flew from Oregon to lead this woman's memorial because she's a J1 visa and her family was in Mauritius. They don't even live in the US. They were just gonna friggin' put her in the body bag and drive off. And that's it, and they told everyone to get back to work. There's no, you know, if police die and firefighters die, they bring out fire trucks, they name a highway after you, everyone's got American flags. Like, there's like teamwork, you know, if you die in the military, they blow in bugles, or they give your family your outfit and the Purple Heart and this, that, and the other thing. If you die as a doctor, they just consider you like bad PR, lost revenue, throw you in the body bag, and that's it. It is like brutal. I've seen this over and over again. Isn't that terrible?
There are no words, no words. My question to you is now, fast forward into practice. You're out of medical school, and
Right.
the physician, I know you do not like the word burnout, and we'll get to that in a second, but the physician burnout rate, I just heard it on the news again the other day, and it seems like every year or so the media is getting a hold of it and putting it out there. So, you know, what is it when they're finally in practice? And yes, some of them are working for major corporations, but some of them are in private practice or in a small group practice, and they're still taking their own lives.
Yeah, so first, the reason why I don't like the word burnout is because it's a victim-blaming term that blames the physician for a problem that's not theirs. The system has abused them to the point where they feel safer in Afghanistan getting shot than they do in medical school. And medical school goes on for 4 years plus 3 years of residency. So you have 7 years of like a terrified person who not only is being treated like shit, but they're also watching people die every day and delivering bad news like, sorry, Yoda's stillborn, and oh, your 3-year-old died in a car accident. You know, they have to tell people stuff like that, and people are screaming and crying, and so they have PTSD from just watching people die all day, plus they're treated terribly. So when they get out in practice, they still, I mean, if you could see the wounds, the mental health wounds that they have inside their body, it would be like 3rd-degree burns over 90% of their body. If you could see it, they should all be on ventilators, but they put on the white starch coat and put on a smile and pretend like everything's okay. And so you have people that are really wounded from their training, and they're taught to be in a state of self-abuse and self-neglect.
It becomes
and they're
robotic
people
and
pleasers,
automatic.
you know, so they end up still, even after residency, working 80 hours a week and taking all sorts of shit from insurance companies and their partners, and, you know, like skipping meals all day long, not sleeping properly, not exercising, you know, holding their bladder. You know, they end up with all these problems, and it's just terrible. So they're not happy. They're not, I don't know if you've met a lot of like super blissed out happy doctors. They're kind of suffering.
The ones at A4M are pretty happy, but they've turned the corner.
They've turned their life around.
Right. So what advice would you give to somebody who's either in medical school right now, thinking about medical school, graduated from medical school and practice? What kind of lifestyle changes and what kind of things should they be looking for within themselves, and what kind of changes and modifications should they be making in their life?
Well, number one is they need to follow their original dream that brought them to medical school. Like, they all filled out this personal statement. Some of these doctors, a lot of them knew since they were 8 years old that they wanted to be a doctor. Like, they have these visions of helping and serving and delivering babies, do all this. They need to stay with their dream and not let anyone steal their dream. And then they need to like take care of themselves. Like, you're like a treasure to society. So you have to eat and sleep and do everything that you tell your patients to do, especially when you're in your own practice. Work part-time, make less money, and take care of yourself. Like, you only live once. If you are running ragged, stop taking, stop taking insurance. If insurance is annoying you, then stop taking it. Like, model your practice around what brings you joy, and you deserve to be happy. Like, that is the basic message. Don't suffer. And if you're suffering, call me. I can help you. I've run the suicide hotline. I know how to help doctors.
No, you were given this sign, this message from above during the time of your suicidal breakdown. Most are not given that message. So how is a physician or someone able to identify what manifestations are happening with them? for them to just stop in their tracks and realize, oh boy, this is bad. I need to stop doing what I'm doing and break this cycle.
Mm-hmm. Well, I think all physicians need to be getting mental health care because it's a high-risk profession. If you look at, like, for example, dental health care, like if you didn't brush or floss for like 30 years and ate Halloween candy, like your teeth would be hanging out of your mouth. The thing is, doctors are in a high-risk environment for mental health problems, and they're not brushing, flossing, or doing anything. They're just told, suck it up, get back to work. Oh, there's a stillborn in room 3. We'll get in room 10. Mrs. Jones having a heart attack. Oh, well, hurry, get in the next room. There's like, 3 people, whatever, gunshot wounds, from a school shooting. Like they just keep telling them, keep going. They never, if you think about it, that's insane. They're looking at things that most people don't want to look at, and they're having to deliver terrible news to families. So, like, I don't care if you're a psychiatrist, a radiologist, whatever you are, like, you need to get mental health care at intervals or you're gonna have like a mental breakdown. And because physicians are so good at compartmentalizing, they don't recognize that they're having a breakdown till they completely crack. Like most of these doctors who've survived their suicide attempts, when I ask them, how long did you know, like when you finally decided you were going to kill yourself, like how long before you grabbed the gun and shot yourself or took the pills? 3 to 5 minutes. Like it is at the end a super impulsive decision. However, there was like hundreds of missed opportunities to help this person earlier because they compartmentalized it, because all the time I hear these stories of like, well, he just bought tickets for his whole family to go to Disneyland 2 hours before he shot himself, or he just finished this major surgery and with a great success on a knee replacement, and then we found him hanging in the closet. You know what I mean? Like the last thing to go with doctors is their medical skill. Like they will be doing complex surgeries to their last breath and then go and hang themselves in the closet. So like most doctors, you can't even pick up. I would just assume all doctors are suicidal and be nice and help them. Like they all need love because they've been wounded, like in Afghanistan, essentially. They've been through a war zone of an educational experience. And some are in denial about their wounds because they just, big house, big car, pretend like everything's fine. But they're like wounded people. They're like the walking wounded. So one simple thing that patients can do is just write thank you notes. Like if you've gotten good service from your doctor, like please just write a note, even if it's 3 sentences. Thank you so much for explaining what's going on with my kidneys. Nobody else had taken the time to do that. I really appreciate you. Like these cards, actually, doctors have told me thank you cards have prevented their suicides. They save all these cards and read them over and over again to remind them why they're doing this work. And so your actual thank you note to a doctor could save their life.
I'm astounded to hear the fragility of the physicians, and I think about my doctors and all the doctors that I've had in my life that have taken care of myself, my parents, my kids, what have you. And you don't think about that, and it's a narcissistic relationship, and you don't think about
them needing anything.
They're superhuman. Right. They have superpowers. They've healed me. They've healed my parent. Whatever. They didn't heal my parents, unfortunately, but that's a whole other story. But it's very hard from a patient perspective to change the paradigm, and think about the physician. And you want to feel, you don't want to be so selfish, but knowing that it could ultimately save that person's life. I mean, why?
Just to be nice.
Just to be nice. It takes 30 seconds.
I know. It doesn't hardly take any time at all. Yeah.
Wow.
Yeah, and patients like in the emergency room who will like bitch and complain because the doctor was a few minutes late giving their grandmother Tylenol, where they were in another room where a man just died of a gunshot wound. Like people are not understanding like your insensitivity and level of urgency for something that's not that critical, and you put that on a doctor who's just dealt with somebody dying or a stillborn, is really like, just like calm. This isn't like Chipotle burrito, like just calm down, wait your turn and be nice. These people are stressed out.
There's so much talk about, and especially in the forum like A4M, there's so much talk about the fact that now the physician has the time to show the compassion, to show the empathy, to listen, to spend time, an hour and a half with the patient if they, if need be, to really get to a root cause of a problem. So turn the tables a little bit to have that patient actually have the compassion and the empathy to be sensitive to their physician. Now, in an allopathic relationship, that relationship is, I mean, it's almost, unheard of for a physician to spend that kind of time and to be able to, they might be compassionate, but that's, 7 minutes you're out the door.
Mm-hmm.
But for an integrative, functional anti-aging medicine, concierge practice, what have you, you have that time to build a relationship on both sides. So I can imagine that from this perspective, there's probably, the statistics of a physician suicide are probably
a lot less.
Far less.
Doctors practicing in what I call relationship-driven practices versus production-driven practices.
Have you heard of a physician who was suicidal, that other than yourself, that recognized the fact that they were in danger of hurting themselves and then started a concierge practice or an integrative practice?
Oh, I don't know that I've heard of anyone that was that far gone with suicidal thoughts and then started to practice. That's a sort of a, they probably were in pain, and that's what generated their interest in changing or coming to these conferences or whatever, but I don't know if they got to the point of laying in bed for 6 weeks, which I consider a first world luxury. If I was in a third world country, I would not have the luxury to be able to lay in bed for 6 weeks and be suicidal. You know what I mean? Like some people, they have kids to feed. They have to sort of keep going, so they're compartmentalizing it, and they're not like feeling the pain. And I was lucky.
You were very lucky, and I feel fortunate to the fact that you were lucky, because I feel lucky now that we're able to disseminate this information, which is so valuable. So you were given the nickname Physician's Guardian Angel, obviously for this reason, but how did that come about?
So TED-Med invited me to deliver a TED-Med talk, and they come up with these cute little tagline names in committee meetings, and apparently that's what they named me. So that's how they introduced me on stage.
Can you share with us a bit about what your TED-Med talk was about?
So my TED-Med talk is called Why Doctors Kill Themselves. And I was basically reading suicide notes from doctors who died by suicide while their pictures were up behind me, and then dropping their notes on the floor.
And how did you obtain those letters?
I'm now friends with all these families. I'm on the phone with mothers who've lost their only child to suicide in medical school.
My son, the doctor.
Yeah. It's very sad.
He's now dead because he killed himself.
Right, and they don't see it coming. Like their perfect star child, like the one that made straight A's, that never cursed, that was always, the responsible, if you have multiple children, the really responsible one that never gave you any trouble.
Right, that you at least expect.
The police are calling you to tell you they're dead.
So what do you attribute the rise and the increase of physician suicide to?
So when my parents were practicing medicine, obviously in the heyday before production-driven medicine, most physicians will say, even now today, that the primary joy that they receive from practicing medicine is from the relationship with the patient. That's been stolen from them by all this third-party intrusion, because you perfectly pointed out, in a 7-minute visit, you're not getting a lot of joy of the personal relationship. You're just getting rushed through computer windows and not even getting to look at them. And so like the EMR and all sorts of government mandates and all the things that, all the infrastructure that's grown up around physicians to steal their income and leave them with scraps and patients. And the student loan debt. These doctors are graduating with like $300,000 of student loans, so they don't see how they're going to pay that off, so they feel trapped. A number of these younger ones who've died by suicide, they don't necessarily leave a suicide note, but they have all their loan repayment paperwork out on the kitchen table for their parents to find. So they're obviously stressed out about how they're going to pay their debt, and the only way they can think of paying it is by killing themselves and having it like wiped clean, because you can't file bankruptcy somehow with student loan debt, like you keep it forever.
So there's been a growing amount of media attention on this, but how come there hasn't been any change?
Because the powers that be in medicine are somewhat resistant to addressing the core issue, which is the system is sick. They're really good at telling doctors they're burned out and trying to get them to do yoga and meditation, but that's like telling somebody that's a prisoner of war to meditate their way out of the prisoner of war experience. And basically, when you are sleep deprived to the point of having seizures, which some of these people do, and food and water deprived because you're doing 10-hour surgeries and you have to do water deprivation before you'll pee during the surgery, so you can't drink water. I mean, they're getting kidney stones, they're fainting during surgeries, and they're getting bullied and thrown scalpels at, you know, like they're being treated like shit, sexual harassment, you know, like all this stuff is happening, you know. Yoga is not going to solve that. That's just something else on their to-do list. When are they going to do yoga? They're having they haven't slept. You can't do yoga when you've been up for 120 hours on a work week. So the problem is the system that has generated the environment that is killing these people and is quite culpable for these deaths and should have class action lawsuits and wrongful death lawsuits leveled against some of these hospital systems for all these. I mean, there's clusters of suicides at like particular schools, 3 and 6 months at one school of residents that died by suicide, 3 within 2 years at another school, you know, like brand name first world country schools, you know, like yoga and green drinks aren't going to solve this. This is like the system needs to say, wow, these are human rights violations, not burnout. It's not like when you tell somebody they're burned out, they feel like, oh, I don't fit in, it must be my fault. They don't think this is a human rights violation. It's hard for people to like make that connection, like it's not burnout, it's not the doctor. This was a valedictorian who was president of every club. Do you know the history of the word burnout? Really interesting. It's a slang term from 1972 used to describe end-stage drug addicts dying in alleyways.
Oh my goodness.
So see, that has nothing to do with the majority of physicians in 2018. This word has been sort of latched onto by the general public because of mental health stigma. People don't want to use the real term of I'm depressed, I'm suicidal. They would rather say I'm burnout because it doesn't sound as bad, but it's an inaccurate label that doesn't really claim the true problem. It's like if you don't come up with the right diagnosis, the treatment plan will never work. So they're telling like the majority of doctors that they're burned out. That doesn't make any sense. And they've been talking about this for 40 years.
And placing the blame on the doctor.
And they've been talking about physician burnout for 40 years with no friggin' solution in sight.
So how many Americans will lose their physician this year?
Over 1 million Americans are going to lose their physicians each year to suicide. 1 million Americans. This is a public health crisis that's not being tracked by the CDC. In fact, I'm sitting here in my bedroom at home tracking all these suicides. Like, nobody else is really tracking these properly with the amount of detail required to understand why these deaths are happening, you know? And nobody is tracking medical student suicide either. We don't even know how many medical students die each year by suicide. It's like they don't want to track it because it's bad PR. You know, like, does a medical school really want to say we had 3 suicides this year? Doesn't sound that good. You know what I mean? But like to ignore it just perpetuates the
Sweeping
death.
it under the rug.
Right. Yeah.
So how are things going to change?
By a grassroots, you know, revolution, which is going on now. What's changing is that medical students coming in and residents are intolerant. They're intolerant to the abuse that their elders sustained. Like they don't, you know, any revolution is led by the younger generation.
Well, there's not going to be a
Civil
walkout of
rights.
kids in medical school. So what are they doing?
Well, they're not tolerating some of they're not tolerating the bullying. They're standing up for their rights. They're going to get therapy. They're talking to each other. I mean, social media, you can't hide some of these tragedies. You know, once a suicide comes out, you know, maybe in the 1800s they could hide what was going on. We have social media, so as soon as like they see a body covered with a tarp in front of the hospital, everyone's like, you know, texting each other, trying to figure out who's under the tarp, right?
But there's still the same amount of applicants trying to get into that medical school program. Mm-hmm. Nobody's, you know, walking around to see, oh, are they smiling on campus? Are they smiling in the hospital when they're making rounds? You know, they're not doing what they do like when you walk into and you're touring colleges.
Mm-hmm. Yeah, that's because there's an oversupply of applicants per medical schools. Right. And they don't understand that there's an undersupply of residency slots for the number of medical students that are accepted. So it's kind of like they lack informed consent about what they're getting into, which is part of the problem, you know?
Do you have any optimism that there'll be
I
change?
have optimism all over the place. I am truly a totally optimistic person. I'm just pointing out the problem because there's no way to solve it if you don't point out the problem.
But are you optimistic that you will be able to, and not just you, but you and everybody else advocating for change will be able to affect change in the near future before
Yes.
too many more physicians
Absolutely.
are taking their lives?
I was working on solutions for quite a while. Like, I've been on this for 6 years, and I was kind of frustrated with the lack of traction. But my therapist pointed out to me that you can't really solve a problem that nobody knows exists. So I was like, oh, I got to go back to increasing public awareness and decreasing professional denial, because there's still physicians who'll say we don't have a suicide problem.
But the media's been reporting this for years.
You know how people can keep their heads in the sand if they, if it doesn't fit.
So it's on Dateline, they don't care. It's just another media story.
Yeah, they don't, fake news or whatever they'll think of it. Who knows? People have. Why does 1 million people that are Christian all disagree with the Bible? You can read the same verse and everyone has a different opinion. The same thing here, okay? Like, not everyone believes that it's a problem. Most people I talk to do, but there's resistance on the part of older generation physicians and medical systems and the old guard that runs the medical profession at addressing this.
Well, it needs to be a changing of the guard, right?
Right, yeah. Oh, and I just want to point out there's a new documentary that came out, donoharmfilm.com, and so that's going to create a lot of culture change because it's a full feature documentary by an Emmy-winning filmmaker that really digs into why this is happening. And so when you have a really good film in movie theaters and DVDs and Netflix, people are going to see that in a way that this wasn't available. This information was not so widespread. And once people have this information and social media, they can make different choices about whether going into medicine is right for them,
So let me ask you, from the patient side, when they go to see their practitioner, in addition to obviously writing the thank you note or just telling them how important they are in their lives or what have you, what clues or cues should they be on the lookout for to just be able to better identify if their physician is struggling?
Well, obviously, if they're sort of grumpy and if there's been a change, if their practice just got bought out by a hospital and now the doctor's grumpy and now they're running behind an hour and they used to be more on time, you can kind of figure out like, oh, wow, they don't look so good, they look depressed. There's sometimes signs like that, but a lot of times there's no signs.
It's like I'm just thinking, it's like I just want to make an appointment with my doctor just to do a head check to make sure they're okay. Nothing to do with the fact that I need to get a physical or whatever. It's just you wonder if, and is it okay to cross that line?
Yes, especially if you do it I would recommend highly to do it more in written form than in person, just because they're sort of suspicious by nature and distrusting because they're prisoner of war survivors, you know what I mean? And they're intellectual people, so they like to digest material by reading it and thinking about it. So like if you sent you could talk about how much you love them or whatever in person, they might not take it in and they have another patient waiting, so they're trying to get out of the room. But if you sent them a thank you card, they would read that over and over and over again. See, it would have a lifespan for possibly decades, depending on where they save it, so I think it's much better to write it and let them digest it in pieces later versus trying to hug them and give them flowers or, I don't know, some of them might be uncomfortable because they don't know what your motives are. They're like, oh, does this person want narcotics or being nice to me they don't really understand, some of them, so. And then there's the whole gender thing, you know what I mean? Like, oh, it's a woman giving flowers to a male doctor, it's just better to do the thank you note, I think. Just keep it simple and meaningful and related to your true appreciation of their care,
You're doing God's work, Dr. Wible.
Oh, thank you. I guess that's why they call me the guardian angel.
Guess so. So any final thoughts?
Well, I started in December a love letter campaign for doctors and medical students, so that's very fun and something that anyone can do. Like, for example, I happen to mention it to, and I just say love letters because I like the sound of it, but it's really like appreciation letters. It's not like, falling in love with your doctor letters. But I mentioned it to a few people in my town, and they're like, oh wow, that's such a great idea. I'm going to do this with my church at Christmas, because like one idea is on Christmas after you finish opening your presents, like why not sit down and write thank you notes to the doctors in the emergency room that can't be with their families and go deliver them, you know, for example, because there are doctors that don't get appreciation, and it would mean the world to them, right? And nurses and others, right? So, and then medical students could leave anonymous love letters for each other in the library. I mean, so there's sort of this trend to just random acts of kindness, being loving to one another. Like there would be huge culture change if we only did that. It would be a much more beautiful medical education and practice for everyone.
Thank you so much for sharing this wisdom, for enlightening us on this, you know, terrible, tragic epidemic that seems to be happening, and for just making it your mission to affect change. So
I think I didn't pick this, like these suicides picked me. That's how I feel about it. Like they come to me. I have a whole wall of my house covered in pictures of doctors who died by suicide in my home office. And so I just feel like, you know, I can't not answer the phone when a mother has just lost their child to suicide, because I have so much information and wisdom to share. And who else are they going to call? You know what I mean? Like I have so much. I even started leading retreats for widows who lost their husbands to suicide, you know. So it's, I just feel very compelled and like I was somehow chosen for this. So I'm just channeling, I guess, the messages from the doctors who come to me in my dreams, by the way. I know it's kind of weird, but some of these doctors have died by suicide. They come in my dreams, they talk to me. And so it's like I get all this insight into like what they want me to do and say and how to help those of us who are still living to prevent these deaths. So I don't feel alone doing this, because I feel like these dead doctors are with me all the time. And it's really profound.
wow,
It's intense. I mean, in a cool, good
it's
way.
an extremely cool way. It's a shame that they couldn't reach out to you before.
Except then I have a philosophy that, like some people, their work is done at a certain age and they have bigger plans that involve the spiritual realm, so I don't always.
Well, I guess you have a lot of angels helping you.
Yeah, there's a lot of guardian angels. So yeah, it's.
Wow.
I think, I personally believe that we should be able to have a world where people don't have to leave a suicide note in their 20s and 30s because of a cruel medical system. You know what I mean? That's just unconscious. It should be a never event in our hospitals and medical schools that anyone should die by suicide. And see, that's the thing. When parents send their kids to medical school, they think that their kids are in the safest place if anything were to ever happen to them. Like if they fell and broke their ankle, they're surrounded by 100 doctors. They would get the best care. Or if, they had a panic attack, if they had, but the parents have no idea it's walking into like a Afghanistan-like situation for their mental health. So that's why it also takes the parents who are not physicians by surprise. So all I'm saying is the simple solution is having a culture of kindness where people really are expressing love to one another. Like even if Medicare never changed and all the commercials, and even if everything stayed the same, right? All the stresses, but if we were just nice to each other, the stress wouldn't matter as much because we know that our partner loves us. Or the medical student knows that the attending really loves them and is looking out for them. You know what I mean? I think it's just the stress plus isolation and loneliness that causes the suicides.
Thank you, Dr. Wible.
Thank you. And by the way, if anyone wants to reach me, I'm at idealmedicalcare.org, and I return every single email and every single phone call. And so if anyone's suffering with depression or panic attacks or suicidal in healthcare, please reach out to me. I talk to people for free all day long who are suffering.
Thank you for sharing that.